how do we protect against these threats that Elvis talked about, and many others? And that starts with a cyber program and a maturity, building the maturity of a cyber program. And one of the best ways to do that is to implement a framework and use that framework as your guiding principles to move your program forward and measure your program and make sure you're aligning to best practices. Two great frameworks out there: the NIST cybersecurity framework, which I have depicted on the left there, and then the HICP framework from HHS. And I'll be talking mostly about that one today. And if all programs should be using some type of framework. There are other frameworks out there for IT, for project management, other parts of IT, or even very specific frameworks for if you're building a security operations center, for example. These frameworks are the guiding principles for your overall program. Today, we're going to talk about 405D, and I'm going to give you a little of the history of that. Sure, let's skip a slide there. So 405D was, there's origins was in the Cybersecurity Act of 2015. It was aimed to align healthcare and cybersecurity practices, and it was a collaborative effort between the government, healthcare, and cybersecurity experts, and really a great partnership between industry, the healthcare industry, and the government to put out these practices. And one of the most important things about this guidance is that it is very tactical in telling organizations how they might address this threat. So I'm going to go through the threats and the best practices in a minute at a high level and give you a couple of examples that map back to a couple of the threats that Elvis talked about today. So this is a voluntary, consistent guidelines for healthcare. It's very healthcare specific. And the 5 key threats that we're going to walk through in a minute: social engineering, ransomware attacks, which Elvis talked about, loss of theft equipment, insider threats, and attacks against medical devices. And I'll talk a little bit today about the technical volumes and the main publications that were produced. And there's many other resources. I'll direct you all. I've put the link on this page, but it's 405d.hhs.gov. There are many other resources available there outside of just the few that I'm going to point. I'm going to point to some of the main documents and things today, but there's many other resources there for your helping to build your program. And we'll talk about the updates to it in the 2023 update. We're very excited about this year that came out. And I'm going to talk through a little bit about why this is really important also to smaller and mid-size healthcare organizations. And I'm going to get into that when I talk about the 2 volumes. If you are going to the website and pull down stuff, make sure you check out the new 2023 edition of the cybersecurity practices. HICP stands for, if I didn't say it earlier, the Health Industry Cyber Security Practices. The 2023 edition, exciting updates to it and some changes to it that I think are really good, and really updating it to meet the current threats and landscape. Let's talk about one important thing that happened in 2021. And the HITECH Act was amended through HR 7898. And this actually called out and recognized 405D and the NIST cybersecurity framework as a recognized security practice. I've heard some people refer to this as a safe harbor. It's not a safe harbor, but it is a great way. If you can show compliance with these one or both of these frameworks, if you have an incident, it does give you some help when it comes to the imposing penalties or audits or corrective action plans. It is a very short, easy read amendment. I suggest if you haven't seen it or read it, that you read that amendment and take a look at that. Pretty sure your HIPAA privacy offers probably and your legal teams know about that amendment that's out there. But it's really important that this HICP guidance was called out as a recognized security practice in that legislation. And the OCR provided guidance in this presentation. There is a link to a presentation from Nick at the OCR. And I put some of the points that were made in there about the implementation regarding these recognized security practices and what the OCR looks for in those. And one of the most important things around all of this is documentation. And I'm going to talk about that in a minute. About your compliance or implementation with a framework or the HICP guidance. I'm going to talk a little bit about the resources and where you can find this guidance. So these are the main resources. If you go to the 405D website, hhs.gov, and two of the main things where you're going to find the guidance in are these two technical volumes. The first one being for the smaller healthcare organizations, and the second one being for medium and large. And so these vary a little bit from what you might, if you haven't looked at these, they vary a little from what I would call like a checkbox, a survey, or framework, in that rather than answering a question and saying, that you do have something implemented, this is telling you what you should have implemented, what those best practices are, and it gives you lots of practical ways and things to look at to implement. So it's a lot of great practices and guidance and ways that you can mitigate those risks. And I'm going to show you a few examples in there that map back to a couple of the risks that Elvis talked about today. So when the 405D, when the working group started out, one of the things that they did with the HICP framework is really based it off what are the biggest threats to healthcare. And we see, I need to update this slide. The first one says email phishing attacks. In the new guidance in 2023, that is called social engineering. There's a lot more types of social engineering and attacks other than just phishing. Ransomware that Elvis talked about. Loss of theft and equipment, or data, accidental or intentional data loss. We talked about insiders. We talked about everything he had on that slide, like the MOVEit supply chain attacks, and that caused data loss and also looped in third parties into those. So one of the nice things about this framework is it's based off and built off what are the biggest threats to healthcare. And in doing that, the guidance then goes into those best practices. What are the best practices? And so you'll find in the documents, this is just a little sample graphic out of the documents, talking about at a high level, what are those practices and sub-practices? And in those, you will find in the documentation, actually under email system configuration, for example, there's lots of great guidance, several pages of things that you can do as a small organization to really help protect your email system. And then all of the other areas that I mentioned, everything from networks to policies to training to incident response, and all of those sub-practices that you need in guidance in a small organization. Conversely, there is a larger version of this for the larger organizations. What I have on the screen here is a snippet from the small organization text. So this came from Technical Volume 1 for smaller organizations. And just to drill down just a little bit, this is not exhaustive. This is just a partial screenshot of a piece of the advice that's in the sub-practices for small organizations around email system configuration that I mentioned. And so you can see here, if you dig down into 1.s.a, it shows you where this maps to in the NIST framework if you're using NIST also in your program. And then it walks through actual guidance on best practices that you can implement in your organization to really protect your email systems and bring up the maturity and raise the bar to help keep the bad actors out. So like I said, this is just a piece of it. There's more to this than what I have on the screen here. But I encourage everybody to take a look at these and drill down into these sub-practices. There's a lot of great advice in here. Here's an example this came out of the new version. This is Technical Volume 2. So this just came out of the larger system framework guidance document. And this is the section 2, which talks about endpoint protection systems. And it walks through a number of sections in here, how to protect your systems using endpoint detection and response technology, mobile devices, endpoint controls you can implement, host-based intrusion detection, and so forth. So there's a lot of great guidance in this section that goes right back to how you help protect your system against ransomware and others threats like that. And in section 2, obviously, there's a lot in this section that also applies to loss of theft or equipment or data. So let's talk a little bit about assessment and implementation of these. You have to evaluate your programs and capabilities, your policies and your practices against the guidance in HICP. And if you're a smaller organization, using really large frameworks or large things that are not maybe have the practical guidance in them, this can be a pretty daunting task. It's I find the 405D HICP guidance to be very useful for the smaller organizations. It's, I think, a little more concise, and it has all the practical guidance in it, and you can align your program, see where you have gaps and things that you should consider doing, then prioritize those risks, design those new policies and procedures, and plan the implementations of the things that are going to help you reduce your risk based on a priority prioritization and project management. One of the most important things is keeping records, documenting these changes, documenting your programs and your roadmaps, documenting the procedures and technical controls that you implement, and how all of that aligns with the HICP guidance. Because as I mentioned early in the presentation, being able to prove that you're aligned, and if you can stay aligned for 12 months and show a prior 12 months of alignment, that documentation is crucial. If you were to have a bad day and have to call Elvis for help, for example, having that guidance all documented, how you align with 405D will help you potentially with your fines, penalties, and any and reduce the burden on the regulatory side. So it's really important to have that documentation and show that over time. Let's talk a little bit about, this is not specifically about 405D or HICP, but in a lot of organizations that I've worked with struggle with insurance renewals or acquiring insurance. They go through a lot of, as the insurance industry has cranked up what they're asking for and their expectations around controls that might be in, they keep adding new things. They keep adding things that are required. And one of the things that I've noticed over time is that the insurance carrier expectations and the best practices in HICP are pretty closely aligned. I know HICP wasn't built off of what the insurance company's expectations were. They were based off industry best practices and what need to guide against those threats. But it is to be expected that the insurance carriers are paying claims for breaches and things that are related to probably what the biggest threats are to healthcare, as one might imagine. So just by the nature of what the insurance companies do and what they cover and the breaches that they deal with, it just kind of naturally aligns that what we see them expecting is also what you would have done if you were aligned with HICP. It's not a perfect one-to-one match all the time in some of the carriers and the expectations, but they're very close most of the time. And so one of the things we see, especially with the smaller organizations, if they can get alignment with HICP, it makes their life a lot easier acquiring insurance, keeping the costs down for insurance, and getting through those renewal processes. And that documentation that they built all along the way, how they are putting in those best practices, also helps